Welcome to our channel, HASHMICLINICS.
All right, everyone, let's jump right in. Today, we're looking at a remedy that, it's not one of your everyday polycrests, but it holds a really special place in our Materia Medica. Think of it as a specialist, a powerful tool you pull out for very specific, very tough situations where other well-indicated remedies have just not done the job. We're going to explore the clinical essence of Ampelopsis Quinquefolia, better known as Virginia creeper. Let's really get into its precise and profound action.
And we're going to start with this statement from S.M. Worthington, because wow, this quote really says it all, doesn't it? It immediately gets to the core genius of Ampelopsis. The key phrase here is resisted other treatment. This isn't just for a difficult case, it's for those intractable cases of renal dropsy, that severe fluid retention from kidney failure, where you've already tried and failed with other remedies. This points us directly to the remedy's superpower, restoring the body's fluid balance when everything else has fallen short. This is our starting point.
So here's how we're going to break it all down today. First, we'll look at the incredible story of its accidental proving, which is really its foundation. Then we'll define the acute choleric picture it creates. From there, we'll see how that translates to its key chronic uses, build out the complete symptom picture, and finally get into the nitty-gritty of clinical application, including a really important comparison.
All right, so first things first, where does our knowledge of this remedy even come from? Well, this is what makes it so interesting. Unlike many of our remedies that were systematically proven on healthy volunteers, our primary understanding of Ampelopsis is built on its raw, powerful toxicology. We learn about its action not from subtle hints, but from the body's overwhelming, violent response to being poisoned by it.
Yeah, the whole story comes from a poisoning case involving 2 children who chewed the leaves. This means the remedy's picture is anchored in real-world, undeniable pathology. The symptoms weren't coaxed out, they were violently produced. And what that gives us is a crystal-clear, unadulterated picture of this remedy's sphere of action, especially on the gut and the autonomic nervous system. It's pure pathophysiology, and it gives us an exact map for its acute indications.
And the progression of symptoms was just so dramatic and so distinct. Take a look at this sequence. Right after ingestion, there was this sudden, violent purging from both ends simultaneously. This wasn't just a simple stomach upset. The fluid loss was so fast and so massive it led to a state of shock, a total collapse with a thready, faint pulse. And then you get this really peculiar feature, a 2-hour deep, almost comatose sleep. But the moment they woke up, bam, the whole cycle started all over again. This exact sequence, violent expulsion, collapse, that weird neurological sleep, and then relapse, that is the absolute keynote of its acute action.
So this dramatic poisoning gives us a very precise and undeniable picture for acute cases. The classical term for this state is choleric, and really getting a handle on this is fundamental to knowing when to use Ampelopsis in an acute crisis.
Now, that word choleric might sound a little old-fashioned, but in this context, it describes this specific state perfectly. We're talking about a violent, overwhelming GI crisis where the body is just trying to expel everything all at once. The fluid loss is so massive and so fast that it quickly leads to a dangerous state of dehydration and complete prostration.
So let's just summarize those keynotes. You've got the violent vomiting and forceful purging, of course, but you also have significant tenesmus, which tells you about the intense irritation along the whole GI tract. The systemic reaction is profound, sweating, a faint pulse, leading to collapse. But look closely at that last one, because this is a crucial clue. Dilated pupils that stick around for hours. That tells you this isn't just a gut issue. The autonomic nervous system is deeply, deeply involved.
But here's the thing. The usefulness of Ampelopsis doesn't stop with that acute picture. Not at all. Its profound action on the body's fluids gives us some really clear indications for its use in some stubborn, deep-seated chronic conditions.
And this is where the beautiful logic of homeopathy comes in. The very same mechanism that causes a violent expulsion of fluids in an acute poisoning can be used to treat chronic conditions of fluid retention. It's all about restoring that balance. And clinically, we've seen it has a special affinity for patients with a scrofulous constitution. You know, that tendency towards swollen glands, sluggish lymphatics, maybe chronic skin issues. That's the terrain where Ampelopsis really finds its footing for chronic cases.
So this affinity translates into 3 primary chronic targets. First, we're back to those renal dropsies, just like in Worthington's case. Second, hydrocele, which is, again, another pathology of fluid getting trapped where it shouldn't be. And then there's this third one, which is super specific, a particular kind of chronic hoarseness.
And here it is, this wonderful, peculiar keynote from Hansen.
It's not for just any case of chronic hoarseness. The indication is so specific. The patient has this hoarseness now, but they also have a history of a scrofulous diathesis, even if it was just back when they were a kid. I mean, that's just a perfect example of using the patient's entire constitutional history to confirm the simillimum right here, right now. It's beautiful.
Okay, so let's pull together the rest of the symptoms from the material to really round out our picture of this remedy and make it something we can really use in the clinic. This table gives us the rest of the essential data points. Notice the abdominal soreness, specifically in that left costal region, could be pointing to the spleen or pancreas. The muscle and joint symptoms are more of a general soreness and aching, especially in the back and elbows. And we see it again, that key neurological sign of dilated pupils. But the single most important guiding symptom on this slide is that general modality. 6 p.m. That's it. That is the golden ticket for ampelopsis, a general aggravation of all their symptoms around 6 o'clock in the evening. This is a high-grade, super characteristic symptom that can be the absolute deciding factor in your prescription. You have to remember this time.
Now we get to the most practical part. Let's put this knowledge to work at the bedside. And that means not only knowing this remedy inside and out, but also knowing how it stacks up against its closest relatives. That's where precise prescribing comes from.
So this is the critical question, right? You're faced with a patient in one of these violent choleric states. How do you know for sure that it's ampelopsis you need and not something else that looks similar? Well, the source material points us towards one really key comparison we have to make.
Let's put a head-to-head with athezia. Now, they both can present with that terrible, violent vomiting. But athesia's keynote is almost always in infants, with that classic intolerance of milk, which is then followed by complete prostration and sleep. Ampelopsis doesn't have that specific trigger or age group. Also, athesia's pathology tends to involve the central nervous system, sometimes leading to convulsions. Ampelopsis, on the other hand, has that unique affinity for the urinary system, producing dropsy and hydrocele. And finally, the modalities are a dead giveaway. Ampelopsis is worse at 6 p.m. The athesia patient is characteristically exhausted and worse after they vomit or have a stool. They are clearly distinct.
So, to wrap it all up, what are the key takeaways? The prescribing pearls you need to remember. First, never forget the 6 p.m. aggravation. It's huge. Second, think of ampelopsis for those really difficult, stuck cases of renal dropsy that have failed everything else. Third, don't forget that wonderfully strange indication for chronic hoarseness linked to a scrofulous history. And from a practical standpoint, the classic texts note it works well in lower potencies. And even the material decoction was found to be incredibly effective for dropsy, so keep these pearls in mind. It may be a small remedy, but in the right case, it's an absolute powerhouse. You'll be glad you have it in your toolbox.
Professor Dr. Rafat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of Materia Medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rafat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.